Good evening. I'm Nathaniel Rodriguez, digital content producer for WDHN, and joining me today is Dr. Agnes Obakor, congenital syphilis coordinator with the Alabama Department of Public Health's STD division. How are you today, ma'am?
I'm doing fine, Nathaniel.
Now, the ADPH recently reported a 143% increase in congenital syphilis in 2020. What contributed to this increase? Did the COVID-19 pandemic have anything to do with it?
Nathaniel, we have maybe three contributing factors for the increase we have this year. COVID-19 happens to be, we have one patient who said it's because of COVID-19, she was not able to seek prenatal care. That was only one out of the 20. The other contributing factors are missed testing during the early third trimester and inadequate treatment during pregnancy. And then we have two other patients who did not seek prenatal care early. So we have two of them out of the 20 did not start early prenatal care. They started very late. And so by the time they were tested, it was too late to treat before delivery. And we want to avoid congenital syphilis when they get treated 30 days before delivery. And then we also have three of these women who did not seek prenatal care at all during pregnancy. So yes, we have these factors, but missed testing during pregnancy and adequate treatment is the majority. That was about 75% of what we have, that's 15. And then two late and three no prenatal care, that includes one that cause of restriction of COVID-19.
All right then. Now, were any particular ethnic groups affected more by this disease for both adults and children?
Yes. The problem with syphilis is that when the bacteria begin to destroy and it's not detected early, so many things happen to the body. And the destruction cannot be reversed after treatment. So what we want to do is to prevent it at the beginning, prevent it or detect early and treat it before it's too late.
Now, where does Alabama stand in comparison to the rest of the nation in terms of congenital syphilis?
Yes, we can only compare Alabama to the nation for 2018 data because of COVID-19, we just submitted the 2019 report to CDC, and then we have not submitted the 2020 report yet. So looking at 2018, Alabama ranked 25 in the nation, and that was when we reported only 7 cases. So in 2018, we have 7 cases of congenital syphilis, and that ranked us in the nation 25. For 2020, with our increase 2019 and 2020, I believe we'll be ranking, we'll be closer to the top, leading the nation. We don't have the data yet, but that is what I'm thinking, because our increase was just a dramatic change from 7 to 14 in 2019 to 20 in 2020.
Now, what are some of the issues a baby may have if they are born with syphilis?
The baby will have several issues. We start with during pregnancy, even when the baby is not born yet, so many things happen to the baby, to the point that some of them will come out at birth already dead. That's what we call stillbirth. Some of them come out preterm, they're born early before their time, and then we also have perinatal death, that they died right after delivery. And we've had, in 2019, we've had stillbirth, one stillbirth, we had a perinatal death, and we had a preterm delivery, which the baby also died. So that during pregnancy, this will happen. Now, when the baby is born, in the first 2 years of life, they can present with rash, and that's a symptom of syphilis, just like it will occur in adults. A baby can have snuffles, they have lung issues and liver issues, so they can come out with jaundice and inflammation of lungs and the liver. And they can also have central nervous system problems, damage. And so you will have a child who will not respond at all. They can have meningitis, that's infection that go in the brain. That's the bacteria causing that. They can also come up with bone deformities. Your bone will be deformed, and it can take along when they're growing. Also, they'll have severe anemia, and it can also cause blindness or deafness in a baby. That's the first 2 years. Now, after that, it can lead on, if it's not treated early during the first 3 months of life, then congenital syphilis will continue to manifest in a child, and after 2 years, you can see teeth damaging and what we call the Hutchinson's teeth. There will also be developmental delays, intellectual disability. So developmental delay and intellectual disability, you can find a child that has learning these problems and you may not find the reason, but it's caused by that, or the permanent damage that is caused by the bacteria before the child was treated can lead to that. Now, you can also have a damage to the nose, what we call the saddle nose, bone damage, blindness, and again, deafness in the child. And these can be permanent if it was not treated early in life.
Now, Dr. Oberkor, I'm going to be honest with you. Last year, we did a report on congenital syphilis, and some of our readers were not very receptive to it. They asked basically why we felt the need to report on it. So could you tell us, why should Alabamians take this disease seriously?
Alabamians should take this disease seriously because, like I said earlier, damages caused by the bacteria is not reversible. So you have an innocent child coming to the world and with a deformity that could have been prevented if the mother was treated earlier before delivery. Now, women who are pregnant can become infected with the same STD, including syphilis. So Alabamians should take it seriously that when you are pregnant, you are not immune from having STDs, including syphilis, which is very destructive. Now, untreated syphilis can cause miscarriage, like we said, stillbirth, premature baby, low birth weight, and death. So that's why we have to take it seriously. And other complications that we mentioned earlier, with jaundice, with meningitis, with blindness and deafness, sure, nobody wants to have a baby coming out and become deaf or blind because of infection that could have been treated earlier. So for these reasons, we should take it very seriously. In addition to that, our numbers are going up. Consider that in 2018, we had 7 cases. 2019, we increased 100% to 14. And then to 2020, we increased again to 20. So the disease is going up. It's very preventable, easily preventable. And that is why we want to make sure that Alabamians take this seriously so we can stop it now.
So what is your recommendation to both expectant mothers and sexually active people in general?
The recommendation is first, they should be responsible. And every woman pregnant, or if you know somebody who is pregnant, just make sure you understand that you can be infected with an STD, including syphilis. Start early prenatal care. Some people wait too late and they still go to the doctor when they're about to have baby, maybe a month before they have the baby, and it'll be too late if you have infection. We prefer pregnant women starting their prenatal care during the first trimester, the first 3 months of pregnancy, so the doctor can test and get them treated. And also, we want pregnant women to be very proactive and also request, if the doctor is not testing them, they should request that they get a test during their first visit to the doctor, and also during their 28 to 32 weeks of pregnancy. They need to make sure they test for syphilis, because like I said earlier, most of these women that we have, or the congenital syphilis cases we reported, 15 of those reported cases could have been prevented if they were tested during 28 to 32 weeks pregnant, so they can get treatment before they have the baby. And I want also the men to protect the pregnant women, because if a woman tests negative at the first visit and then go to labor and delivery and test positive, surely somebody gave it to her. So both Parties should be responsible. Women should be careful. Do you know you can get infected? And partners should be very mindful that you can infect your pregnant partner if you contract any STD which was pregnant. We offer free screening and testing for syphilis and other STDs. So I want the public to understand that syphilis is preventable if we can detect it early in pregnancy and get a mother treated 30 days before delivery.
Well, many good points, and absolutely people need to take care to use those resources that are available to them. Dr. Oberkor, we hope that this brings awareness to the condition and lower the cases for this upcoming year.